Good evening, ladies and gentlemen, my distinguished panelists, and all the viewers. I'm Dr. Nishant Sharma, and welcome you all to another episode on patient awareness. As we know, November is Lung Cancer Awareness Month, and I'm pleased to announce that this panel is a joint initiative by Voice of Healthcare in association with Pfizer, where we'll be talking about lung cancer in India, specifically talking about overcoming the challenges, building awareness, and talking about driving advocacy. So, without further ado, allow me to welcome my expert panelists for today's discussion. We have Dr. Bhavesh Parekh, Senior Consultant Medical Oncologist at Marengo CIMS Hospital, Ahmedabad. Good evening, Dr. Bhavesh. Thank you for joining.
Good evening, Nishant. Nice to hear you from.
Thank you. Thank you, Dr. Bhavesh. We have Dr. Rakesh Sharma, Consultant Medical and Hemato-Oncology, Max Super Speciality Hospital, Saket, New Delhi. Good evening, Dr. Sharma. Thank you for joining.
Good evening. Thank you. Thank you.
Yes, we have Dr. Suhas, Kirti, Singla, Consultant Medical Oncologist and Hemato-Oncologist, Positron Multispeciality and Cancer Hospital, Rohtak. Good evening, Dr. Singla.
Good evening. Good evening.
Thank you for
Glad
joining.
to
And we
welcome
have Dr. Amit. We have Dr. Amit Bhargava, Senior Consultant Medical Oncology at Fortis Hospital, Vasant Kunj, New Delhi. Good evening, Dr. Bhargav. Thank you for joining.
Yeah. Thank you. Thank you. Good evening.
Yes. So before we delve into the conversation that I had shared with you, let's give all our audience joining a little bit of introduction, a little bit of setting the tone of this conversation. So I'll start my introductory question with Dr. Amit. Dr. Amit Bhargava, please educate our audience about what exactly is lung cancer to a layman and what are some common signs and symptoms that we see, please.
See, any kind of a cancer developing within our lungs, in a broad terms, we label it as a lung cancer. At a broad level, we divide lung cancer into two categories, small cell and non-small cell. And there are further divisions of lung cancer. Now, if we talk of symptoms of lung cancer, the commonest symptoms is cough. And in India, it has been a challenge initially because tuberculosis, pulmonary tuberculosis was very common. And the dictum was any cough prevailing for more than 3 weeks used to be treated as tuberculosis, even without investigations. So that actually increased our problems in diagnosing lung cancer in an early stage. So cough is one of the commonest symptoms. Now, as the tumor grows within the lungs and involves the blood vessels or something, you start getting blood in your cough. That is another symptom. Next is if it further grows, involves the adjoining bones or the rib cage, you start getting pain. That is one of the symptoms. If your bronchus are involved and you have constriction or the restriction of the airway, you get breathlessness. So these are upfront, the common symptoms of lung cancer by virtue of its local extension.
Right.
Once it becomes metastasized, say it goes to your bones, it goes to your brain, you get symptoms pertaining to that, like you may have pain in your spine. If it goes to the brain, you may have seizures, you may have giddiness, you may have loss of consciousness. All these things, may happen as the lung cancer grows in size and its extent.
Right. Thank you, Dr. Amit, for that wonderful introduction to this session. Dr. Singla, continuing to the introduction, as a clinician, how is the diagnosis for a lung cancer made? Please educate our audience for the same, please.
So the first thing, what sir has already told, the symptoms are the most important part. They actually guide us that whether this is a disease which is arising from the lungs or not. And then after that, usually the most important thing which we generally do is the clinical examination. On clinical examination, you may find some kind of decrease in breath sounds. You may find some kind of stridor or some kind of wheeze on examination, and later on there comes the part of your radiological investigation. Generally, as a general physician usually does is they start with chest x-rays followed by HRCT thorax, and if at all a lung mass is very much evident, then usually people do proceed with either a PET CT or a CCT abdomen and thorax to understand the extent of the disease. And if PET CT is already done, then there is no need to continue with a bone scan. But if a CCT thorax and abdomen is done, then a bone scan is mandatory in case of CA lung. And as per few guidelines, MRI brain is also very much essential, because almost 10 to 15% of patients at initial presentation do have some kind of brain metastasis.
Right. Thank you. Thank you, Dr. Singla, for educating us about how clinicians such as yourself reach the conclusion of lung cancer. Dr. Bhavesh, my next question will be for you in continuation. So, what are the treatment modalities available? As both of your previous panelists just talked about different grades and different extent that the lung cancer extends it, what are the different types of treatment modalities that the general public should be aware of? Please.
A very good question, Nishant. After having a brief introduction about the symptoms and the stage and the grade, the various treatment, the most of cases in India we found is generally in a stage 3 or stage 4. Very early, like stage 1 and stage 2 cancers is very few, less than 10%. So most
Mhm.
probably, the most of the stage 3 and stage 4 patients required chemotherapy, radiation therapy, and sometimes surgery also. So especially when in a stage 3 case, where sometimes we give concurrent chemo radiation, or sometimes we can give neoadjuvant chemotherapy followed by either surgery or followed by radiation therapy. Nowadays, a molecular therapy or a targeted
Mhm.
therapy, or very important is a immunotherapy, is very important in the lung cancer. So I would like to say that new technology or new modality, especially as a medical oncologist, I feel that there is a definite role of immunotherapy, targeted therapy, as well as a specific EGFR directed therapy, where even oral tablet is can be helpful even in stage 4 patient. Thank you.
Right. Thank you. Thank you, Dr. Bhavesh. Dr. Rakesh, before we move over to our round one of discussion, my last question to you in terms of introduction. The rest of your panelists have spoken about what lung cancer is, the kind of symptoms, the kind we are able to make diagnosis, the treatment modalities. I'd like to understand, and our audience would like to understand from you, talk about the prognosis that we see in lung cancer. How is life after lung cancer for a patient diagnosed with, let's say, grade 1 or grade 4? Please, over to you.
So the prognosis of lung cancer depends on multiple factors. One of the important factor is the stage of lung cancer. Another important factors are the mutation profile, particularly in stage 4 disease. Now we have lung cancer which are particularly driven by a particular mutation, and we have targeted therapy pertinent to those mutations.
Mhm.
So generally, patient with stage 1, 2, these tend to do better as compared to stage 3, 4 patients. In stage 4 patients, those who are driven by certain mutations, they have better prognosis as compared to other which are not driven by any mutation.
Mhm.
Also, these mutations are also determined by the smoking status of the patient. So patients without history of smoking tend to have higher chances of having these mutation, driving mutation. And ultimately, if there is a mutation, they tend to have better outcome. If
Mhm.
a patient is a heavy smoker, then they are less likely to have some driving mutation that can be targeted with some therapy, and they tend to they have poorer outcome as compared to other patients. So all in all, the most important factor determining the outcome is the stage. In stage 4, mutation profile, history of smoking, and also general condition of the patient. So these are the 3 4 main importance that ultimately determine the fate of the patient.
Right. Thank you. Thank you, Dr. Rakesh, for talking about the prognosis and
Dr.
like.
Nishant, I cannot hear.
Oh, Dr.
Uh,
Amit, can you hear us, please? Uh, Dr. Amit, can you hear us? Yeah, in that case, Katayani, please reach out to him over the cell phone, have him disconnect and maybe rejoin. So, thank you, Dr. Rakesh. As I was saying, thank you for your answer. And let's move over to our discussion now. Dr. Suhas, my first question will be for you. How important do you feel is raising awareness about lung cancer important, specifically in India? And being a clinician, being a medical oncologist, what do you feel can be done to encourage people to be more aware about their lung health? Please.
So wonderful question to be very frank. Uh, Raising awareness about your lung health is as important as raising awareness about diabetes, heart diseases, or anything else. So today, to be very frank, lung is becoming next the most important organ. Reason is coming up the pollution which we are today these days we are seeing. So even patients who are actually non-smoker are being exposed to the carcinogens from the general pollution status of the environment. So that
Right.
is very very important. And why it is important to know about lung cancer is another point which I would like to add on in this is because incidence of lung cancer as per Globacon data for India had been 6% of all the cancers occurring in India. And I think this is a bit short of actual data being available in our country. And and to my shock, if we go through the data again, almost the mortality, cancer-related mortality is to the tune of 8% due to lung cancer in India in particular. So what this becomes? This becomes that this is a highly mortal cancer. So a patient in totality, we are unable to actually save more number of patients than the number of patients being diagnosed with this cancer. So
Right.
that's why this becomes more important to understand that whether this cancer is to be known or how. Now next part of the question was how we can actually raise the lung health awareness.
Yes.
So the most important aspect I think is knowing that what affects our lung.
Mhm.
So, what affects our lung? Pollution affects our lung, smoking affects our lung, radiation exposure affects our lung, your occupational status affects our lung. So, we should be knowing that from where, what kind of precautions we need to take. For example, if we are moving in a polluted city like metros or NCR, so we should be very clear that we have to wear a proper N95 mask, and we
Correct.
should not be sleeping without a proper purified environment or a purified air. So, and for the person who are smoking, they should be aware and they should be made to understand that this is one of the most harmful substance which you are actually addicted to. And this is not only going to affect your lung, but to the whole body as such. It is responsible for your cardiac diseases, it is responsible for your gastric upsets, it is responsible for multiple nth number of carcinomas you may talk of, including lung cancer, which obviously becomes the most important in this. So that's
Yes.
how I think awareness can be raised, and that's how I think awareness should be raised.
Right. Thank you. Thank you, Dr. Singla, for giving your wonderful piece of advice. Dr. Amit, I hope we are audible to you now.
Yeah, yeah. Now I just missed the in between part. So now I can hear and I
No
think so.
problem. No problem, Dr.
I'm
Amit. So we were just discussing with Dr. Suhas and we spoke about how is it important to raise lung cancer awareness. My question for you will be, I'd like to understand, the audience would like to understand from you is what are some key challenges in preventing lung cancer in India? And do you feel that different regions, different demographics of India happen to have different challenges? And if yes, how do clinicians such as yourself feel to combat such challenges, please? Dr. Amit, appears that your internet.
right from our training
Okay.
periods, we took a lot of activities for preventing lung cancer, but somehow none of them could succeed. The biggest challenge that what I feel that we are facing today is illiteracy. Illiteracy as far as the health, not only just lung cancer, but overall pertaining to human health, uh, is one of the biggest drawbacks in our country. And the other issue that what I see is maintaining a good hygiene. If where the place where I stay, it's in Delhi, you see the pollution levels there, skyrocketing.
Yes.
Now, these are few of the things which I feel was a challenge. Now, if I come to the exact etiology and the biggest culprit in lung cancer, that is tobacco and smoking. So that is something which is you know actually uncontrollable. What I see is that when I came to Delhi from Mumbai and started practicing, I was really amazed to see young children of class 10th, 11th, and so they were smoking. I used to go out with my friends for dinner. I used to see a lot of young people smoking. And the longer you smoke, you have a latent period of approximately 10 to 15 years in procuring, and getting lung cancer after smoking. So by the time they get lung cancer, they are in their productive age group.
Right.
So, and they lose on that. So that is the reason we are having a lot of young patients with cancer. So that is one thing. And when we wrote letters to the ministry regarding quitting all these smoking issues and stopping the pawn shops or something within 5 kilometer area of any teaching institute, but these things are all on papers, but the implementation is pretty slow. So that is one of the biggest challenges that we face. The other thing is, the challenge that at least as an oncologist I face is the taxes on smoking. The taxes are so huge on smoking that government doesn't want to give up tobacco factories and all the factories which manufacture cigarettes. So that becomes a biggest challenge for us oncologists to tell anyone not to smoke when these cigarettes are easily and freely available at a stone throw away distance of you, and you have an access to everything. Then things become really challenging. The other issue is that we have protocols that not to smoke in public places, and if you go outside India, you have smoking cabins and everything. But in India, in most of the public places, there are no smoking cabins or an isolated area where people can smoke. So invariably, people smoke in public areas, but
Mm.
unfortunately, no action has been taken against this rule of smoking in public places. So, these are one of the biggest challenges that I see in treating lung cancer. The other is that when you subject the high risk population for any, their question is that why should we?
Mm. Dr. Amit, we're missing out on your voice in the middle.
I think so. There's a connection issue.
No problem.
So,
Please continue.
uh, so that is, these are some of the issues. So, like when we were in Tata, we came out with a protocol of a low dose CT, wherein you screen the chest with by giving a very low dose of radiation uh, for people who were at a very high risk of developing lung cancer, especially who had been smoking uh, plenty of cigarettes in a day. So now implementing this thing in a private practice, telling anyone who's asymptomatic to get a low dose CT done and spend maybe 3 or 4 thousand rupees is a big challenge. And most of the corporates where people work or in the government institutions where people are working, they do not have a routine health check protocol for everyone. Whereas if you go to companies like Google, they do not give you a promotion, they do not give your recommended remunerations at the end of the year till the time you have a complete health check with you. So this is something, a big problem which I see in our country, and I see these things as a far-fetched problems that we can have any kind of a solution
Mhm.
without involving the health ministry or the government at a central level, and they should take up this issue uh, in a big way, because in my clinic I see many patients, younger patients who are actually in their productive age group, and they're the only earning members in the family. So it's a big drawback to the society, where the working class or the working population is lying in the hospital beds or the ICU.
Right. Thank you, Dr. Amit. Very, very wonderful insights and very nice, uh, I would say, pointers on the different kind of challenges that you feel. We'll circle back to you with more questions. Dr. Bhavesh, my next question will be for you. I remember in the introductory part you were talking about incidence. So this question will be very specific. How common is lung cancer in India? And please talk about the current incidence that we see, and is there any demographic variation, being a clinician, that you have observed, please?
So, as a clinician, what I observe that, as again one of the panelists already told, that definitely there is a, according to Globocan data in India, it was a 6% incidence, or among the all the cancers we observed in India, the lung cancer is the in the male it was the second commonest cancer after the head and neck cancer. And again, as far as the various demographic data, in the northern part of the India, the incidence of lung cancer is very high. Even on the western part, as Dr. Bhargava also told, from Delhi to Bombay, the pollution part and the smoking part, or the young generation, the history of smoking and long-term smoking, the various occupational hazards also. So this all feels that ultimately the incidence of lung cancer. And what, as a clinician, I found that gradually the age where we studied in 1995 or 2000, where the age commonest or median age for the lung cancer diagnosis is round about 45 to 60, and now I feel that it is little bit in a younger age, like 35 to 40 years. And especially in the female, now the gradual the smoking incidence is also increasing. And again, the passive smoking, the role of passive smoking, sometimes where the public transport, where the bus and the train, or where the common public place where the smoking is very much hazardous, and there is no clear cut laws. So I feel that definitely there is an increasing incidence, and the increasing age, or the more common age, more younger age, where we found a lung cancer. And gradually, like a female lung cancer is also increasing, where initially it was the male lung cancer part was increasing. So I personally feel that gradually the incidence of lung cancer in India is increasing, while in US it was decreasing because of the habit of smoking.
Right. Thank you, Dr. Bhavesh, for that answer. Dr. Rakesh, my next question will be for you. So, as the rest of your co-panelists and you yourself have very rightly spoken about the use of tobacco and lung cancer and the incidence that pollution has on lung cancer, my next question will be, in addition to such pointers, that what can the general public do to prevent lung cancer? And please enumerate these points. And do you feel, very similar to the previous question, different parts of India, are there going to be different things that one person can do? Please, Dr. Rakesh.
So, as highlighted by previous panelists, that main risk factor for lung cancer is smoking. So, it should be the main preventive step will be to if someone is smoking, he or she should stop smoking. If someone has never smoked, he should be reinforced that it should be avoided at any cost. Usually the smoking habit started in younger age group because of the peer pressure. Some say it is because of the stress. So he or she should be reinforced that it is a bad habit, it should not be uh, encouraged, and people should have someone to talk to in stressful situation. Parents here can play a major role, as in this age group most of the youngsters don't find such attachment with parents that they can share their stress with them. So these are the situations which ultimately lead to the habit of smoking. So If someone has never smoked, there should be some support program which about the situation which are ultimately leading a person to smoke. If someone is smoking, he or she should be reinforced to smoke, as it has been proven in various studies. If someone is smoking for a longer duration and they stop smoking, after a span of 10 to 15 years, their risk of developing lung cancer decreases by 80 to 90%. So the most important preventive measure will be to if someone to stop smoking and encourage people to not indulge in this deadly habit. So this is the first factor that can be encouraged for the prevention of lung cancer. Other measures are like in occupational measures, like in certain occupation like miners, those who are working in factories, train track workers, welders working in insulation factories. There should be regular health checkup of these individuals to prevent to detect early stage lung cancer, so that they can be treated at earlier stage rather than developing the stage 4 disease.
Hmm.
So most important factor will be prevention. For prevention is not to indulge in smoking, or if someone is smoking, he or she should be reinforced to stop smoking.
Right. Thank you. Thank you, Dr. Rakesh, for enumerating the different preventive measures. Now, this question, before we end the first round of discussion, is an open house. I'd like to hear each one of you panelists' thoughts. We'd start with Dr. Singla. So, Dr. Singla, the question is, we have spoken so much about how youth is engaged in smoking and picking up the habit of smoking in the early years of life. In what ways do you feel can youth be actively engaged in advocacy of lung health, and what role do you feel that this will have in the future of lung cancer awareness in India?
So you are talking about youth. The youth is the driving power of a nation. So, to be very frank, a youth can change the scenario all over. They can obviously change how we think, how we progress, and how our lungs do behave in near future. So, how what youth can do? That is one query which you raised. So,
Mhm.
youth can actually ask the government to make policies and which should be reinforced with all the forces, increase the political will to stop tobacco products, to make sure that at least whatever teaching institute they are in, there no vendor should be allowed for selling his or her smoking as a smoking or a tobacco related product. Second,
Right.
they can also help many other people around by doing a lot of nukkad nataks, which is one of the very famous way of raising awareness and had been very useful in general population at a large.
Mhm.
Third, what they can do is that they can themselves stop smoking.
Right.
So that is the biggest thing I think they'll be able to help the society with.
Right. Thank you. Thank you, Dr. Singla, for enumerating your thoughts on the same. Dr. Bhavesh, moving over to you, the same question. How do you feel can youth be actively engaged to improve lung health and prevent lung cancer in the coming years, please? Dr. Bhavesh, you're not audible. Uh, I think you might have gotten a call in the middle, so your mic has been disconnected. Just rejoin after disconnecting once, and your mic should be available. We'll circle back to you. Uh, Dr. Amit, the same question to you, talking about youth and how can we have them be actively engaged in making efforts for lung health advocacy, please.
See, my answer would be that most important thing would be education of the youth. We all have gone through the same curriculum in the schools, either CBSE or ICSE. But how many of us know anything about maintaining healthy lifestyle?
Dr. Amit, we're missing out on your
The
voice
most
once again.
important thing what I feel is education of the youth. And what we have done, we did a small pilot program for breast cancer, wherein we did a support group program for all our cancer patients, and we trained them. And these women are the driving force, and they get all their friends, family, and relatives to us for a clinical breast examination or a self-breast examination. So this kind of an exact advocacy we need for lung cancer.
Right.
Patients who have been treated with lung cancer or who are undergoing treatment with lung cancer, their family members, all the young members in their family should be educated that at least within their societies, with the family, friends, and relatives, they can at least uh, advocate not to smoke, take care of their lung health, get regular checkups done, and what is the importance of getting a regular checkup done and diagnose the disease early. So, my whole focus is basically on education, education, and education.
Hmm.
And, if you educate, what I feel is, uh, if you educate one male, you just educate an individual. So it's the female education that is more important. Because if you educate a female regarding a lung cancer, the whole family gets educated, and probably her husband, her brother, would be prevented from smoking, and the fathers, because daughters are a much bigger tool to advocacy of non-smoking and anti-tobacco things than the sons itself in the family. So I feel female education, female youth education about lung cancer is very important. Moreover, we must have a very strong advocacy regarding and strong policy and of smoking within the public areas, because when a person smokes in public, he not only damages his own lungs but also by causing damage to others by virtue of passive smoking. And
Right.
passive smoking is also one of the major causes for lung cancer. You cannot ignore passive smoking. And we do not have a habit of telling someone to stop smoking if he is smoking right onto your face.
Even if you tell somebody, so that person comes on to you to have an alteraction.
Absolutely. They feel as if you committed a mistake, and they will just fire at you.
Yes.
So
Right.
it's a difficult proposition. It's a big challenge. But still, I feel education can definitely change the scenario sooner or
Right.
later.
Right. I think having the adults unlearn and relearn the importance of lung health, having youth being educated about it will build the path towards a better future. Uh, Dr. Bhavesh, I hope we can hear you now. Can you speak something?
Yes. So as
Yes,
far
right,
as
please.
the So, as far as the youth awareness is concerned, I think as a clinician also we should go more and more to the institute or a teaching institute in the college and in a local language by telling them our experience of the patients and how they suffer. And if the youth, because most as our Prime Minister of India also telling the youth is the asset, and youth, if we can educate them, they are the people that can help definitely to decrease the incidence of lung cancer or the prevents the smoking incidence, especially in a young, because one of the panelists also told that if the young people will smoke, then the smoking years has been increased, and that also causes more and more malignancy. So,
Right.
to educate the boys and girls at a school age, at a college age, is and at the local language, and show the pictures of the various lung cancer and their sign and symptoms in a teaching institute, that definitely helps to fight or to have a win the war against the lung cancer.
Yes, thank you, Dr. Bhavesh, for your piece of thoughts on that. Before we move on to the round two, Dr. Rakesh, the same question to you. How do you feel as a clinician that the youth? How can we engage with them actively, and how? Please, Doctor
So,
Rakesh.
as everyone is aware, youth is the main driving force of a country. So, and most of the habits which you acquire that last for the whole age of an individual are acquired in young age. So you can say teenagers tend to acquire any habit that can last for whole age, like smoking is one of them. So I think youngsters can learn from the mistake of others. That is a age old wisdom. Second is mostly we tend to follow role models, especially in movies. Smoking is as shown to be a cool thing. So I think it is a high time one should choose their role model carefully. So this is the message from my side to the youngsters.
Thank you. Thank you. Thank you, Dr. Rakesh. With this, we'll move over to the second part of the discussion. I'll start the second round with Dr. Suhas. Dr. Suhas, my question for you is, as the rest of your panelists and you yourself very rightly pointed about the pollution that we have in the northern parts of India. My question to you will be, given this current state of pollution in India generally that we see also in the northern part, what signs should people be aware of that may indicate that their lung health is deteriorating? Please.
Okay. So I think Dr. Amit has already told about the signs and symptoms of lung cancer. So to be very frank, we have to be aware of them only. So we need to understand that any type of chronic cough, which is persisting for more than 3 to 6 weeks, should be considered and should be evaluated properly. Secondly, if you have a sudden onset of deterioration in your lung status, for example, you are already an asthmatic, and then you deteriorate due to the pollution a lot, rather than more than what you have been. So this may also be a sign that you are developing some kind of lung cancer. Another thing which is very important is any type of blood in sputum, chronic cough, chronic productive cough, which is associated with some kind of infection, a green colored sputum, a yellow colored sputum, which is persisting for very, very long, and you are getting recurrent infections, or you are losing your weight at a very rapid rate along with this cough, then all these things go more in favor that you are developing some sort of lung cancer, when taken into account that yes, the pollution is very much rampant, especially in northern parts of the country. Then we should be very much aware that these symptoms are not to be taken lightly. So
Right.
that is, I think, the symptoms remain the same. It is just that you have to be bit more careful and be
Mhm.
very regular with your checkups, especially if you are already a lung patient for any kind of deterioration.
Right. Thank you. Thank you, Dr. Suhas, for that answer. Dr. Bhavesh, my next question will be for you. What do you think are some major barriers to accessing healthcare services for lung cancer patients in India, and what strategies do you recommend can be employed to overcome these barriers? Please.
So, especially in India, for the barriers for to assess the treatment, the most of the times, the patient when there is a cough or whenever there is a symptoms pertaining to lung cancer, most of the patients will go to the family physicians or a MD chest physicians, and they generally does not have a suspicious of malignancy, and most of the times they are suspecting tuberculosis, or the patient is already on anti-tuberculosis treatment, and whenever there is a no response, or another thing is that since chemotherapy or a allopathic or the treatment of lung cancer, the still the common people feels it is a little bit toxic. The chemotherapy is toxic, the radiation therapy or surgery is toxic, so they are still going for the alternative therapy rather than, so to have a right diagnosis at a right time and to consult a right doctor is very important. For that, or encounter to these barriers or to encounter these problems, I think more and more education, especially the allopathic branch of the medicines, should be educated through such type of seminars, webinars, as well as whenever there is some lung cancer awareness month like November, the media, the electronics media, the newspaper media, the radio and television, they are giving a lot of
Dr. Bhavesh, we just lost your connection there. Uh, okay, we will circle back to him. Dr. Amit, my next question will be for you. As Dr. Bhavesh was also talking about community-driven efforts, and you in the past, in the previous questions, have also spoken about policy changes. My next question to you is something around that fact, that how do you feel can community-driven advocacy efforts influence the policy changes at national and regional levels, which will obviously then improve the lung health outcomes in India that we see? Please.
Oh, again, I always say that uh, though, no doubt, when we consider ourselves as a part of the community, as an individual, I may be a very small entity. But when I make small groups, and these small groups go and advocate even one individual and keep on adding people to it, they become literally bigger. And once they represent a whole society, that is when the policy changes come. And especially in our country, if you see, the we the people of India, we only elect the government, you know and when we vote in masses and we elect the prime minister of the country, we can definitely form groups, small groups and bigger groups in areas which are as per the requirement of that area, and we can change the policy. I'll give you a small example. Uh,
Please.
suppose we came out with a law that within 5 kilometers of area, there should be the selling of tobacco and tobacco-related products, and alcohol should be banned. But we still see today that these shops are still prevalent, and they are concentrated near the education institutes, because the students they take it law. Now, suppose if we form a group within the college, within that college, that we form a group of say 5 people, 6 people, that they advocate that people should not go. So what they can do is, at the start of the school and the end of the school, they can voluntarily stand in front of the pawn shop, and all the students coming from that school to that pawn shop, they can just stop them from
Right.
buying. That is one of a very small step. And once the selling of that pawn shop stops, he'll ultimately have to close it or shut it down, because he's unable to generate any revenue out of it.
Correct.
Just because he is able to generate a revenue from that region, he is continuing. So these are some kind of steps we need to take. Now, if we talk of changing a policy in lung cancer or public smoking, same thing. We need a small group of volunteer, even one volunteer standing at a public place and telling people not to smoke, and he has the authority to do it, or he complains to the relevant authority, who can take an action against those people. Even a small fine of maybe 100 rupees for smoking in the public area is a big amount in our country. So even people would be scared of that. So we need small groups to percolate these things. Whenever you think something big, it has to be step by step. Think
Hmm.
of small changes, and that can actually lead to uh, big changes that can happen. This is something I learned from, there was a movie called as Pass It Forward. So whereas if anyone is doing good to you, you don't return it back. You pass it forward. So same thing when you are learning something about lung cancer, you don't just keep it to yourself or give back to your treating physician, but just pass it forward to the society, to your friends, family, relatives. So that is a kind of a system that we need, and which can actually bring about big changes in the society. We can always control these politicians by being in majority, to change the policies and change the taxations or the revenues what they are getting out of tobacco, and make relevant changes for the society and by the society.
Thank you. Thank you, Dr. Amit, for that answer. Dr. Bhavesh, we lost you in the previous question that I was discussing with you. Anything that you'd like to complete, please?
Yeah. So sorry for that lost part, but again, as far as the barriers is concerned, and as far as to encounter their barriers, is ultimately we have to be clear, or create the awareness in the public that the treatment, the right treatment, and the right diagnosis, the early detection is very important. And if we do a early detection, and if we do a right treatment, like right chemotherapy, right molecular based therapy, right surgical part, then the patient will get benefit. So more and more cured patients, more and more benefited patients, because still some alternative therapy of medicine, there are so many people that they are believing that some Ayurveda, some other therapy, some dendritic cell therapy, or some immunotherapy that has been by the cracks, by the not qualified doctors, they are more prevailing, and ultimately patient suffers, or ultimately patient will not respond. So if we create, as a good clinician, if we create awareness among the doctors, among the family physicians, among our own selves, our own medical society, and especially the MBBS college, where the people will definitely, a new budding oncologist will be definitely convinced that the oncological therapy, or the therapy of the lung cancer at a right time by the right doctor, will be definitely helpful.
Right. Thank you. Thank you, Dr. Bhavesh. Very, very insightful answer. And that was. Dr. Rakesh, my next question will be for you. As we just spoke to Dr. Amit, and he spoke about how community-driven efforts can improve lung health and its advocacy. My question to you will be, we are living in an era of digital communication as well. How do you feel that digital platforms be effectively utilized to engage communities, raise awareness, and drive advocacy for lung health in India? Please.
So digital social media is a very common thing. Everyone has access to Facebook, Instagram, YouTube, and we can see that a lot of videos are made viral. So most of the viral videos are of garbage content. You can agree with me on this part. And people are attracted to these videos because they find them funny. Because of this, a lot of garbage circulating around, we tend to miss the important things. Like if you are to circulate an awareness program on lung cancer, people may not watch it, some will watch it, may not watch it, but funny videos like those are circulating on videos, people tend to find them attractive. So I think people should learn that the in these garbage is not the ultimately thing that will lead to their health, that will benefit in terms of their health. So I think social media can play a good role in advocacy for lung cancer, particularly spreading awareness about the preventive measures. Second is there are some movements, you must be aware about Me Too movement kind of thing that was there in previous few years. So that kind of movement can be started, like no to tobacco, no smoking, prevent cancer hashtag kind of things can be done. And I think, and other thing that if we have to gather people about the awareness program, people can reach to watch World Cup match without any invitation. Lakhs of people can gather. But if you are to gather people for a awareness program, hardly hundreds, few hundreds. If you are so much influential, 1,000 at most. But you can never gather lakhs of people for awareness program. So I think change has to be within an individual rather than it has to be influenced by someone else. So if people tend to educate themselves about the disease, which tend to educate themselves about the disease of lung cancer by themselves and tend to spread awareness about the preventive measure, then I think that can have impact on the society that can last for longer duration.
Thank you. Thank you, Dr. Rakesh, for giving us your piece of thinking on digital communication and the role that it can play in advocacy. So, to all my panelists, with this, we'll bring both the rounds of discussion to a closure. Now, before we close this panel of discussion, I'll start with the last question to each one of you. Dr. Suhas, we'll start with you. Please share your key takeaway for our audience around lung health and preventing lung cancer as we are celebrating Lung Cancer Awareness Month, please.
So the key takeaway, I think, for most of the panelists will be say no to tobacco, stop smoking, and be very aware of your lung so that your lung remains healthy. That's the main key takeaway. And for that, I think the best way around is to help people quitting and be a quitter or stay a quitter.
Right. Thank you, Dr. Suhas. Dr. Amit, your key takeaway for the audience, everyone who has engaged with us in this discussion,
See,
please.
whatever Dr. Suhas has said, I would put it as a headline, and just below I'll write one sentence: spend some time for fitness or be ready to spend time with sickness. So
Right.
that is my takeaway. You need to be, healthy and spend some time for your fitness as well.
Very, very rightly said, Dr. Amit. Dr. Bhavesh, we'd like to hear your key takeaway for from this panel to everyone, please.
Like a car, generally we are doing servicing at the right time. We should also do servicing right time of our body also. The medical checkup, the regular checkup, and at least do some exercise. Try to avoid obesity. The most important, quit smoking, the tobacco in any form, or any bad habits that can have a problem with your health, because now health is a wealth. If you are wealthy but you are not healthy, then you are not real wealthy. It's all on the paper or all in your pocket. So if you want to live more with a good quality of life, then be healthy, quit smoking, and stay happy. Thank you.
Thank you, Dr. Bhavesh. Lastly, Dr. Rakesh, your key takeaway to all the audience here, please.
There is an age-old wisdom: prevention is better than cure. So the prevention is quit smoking, as highlighted by previous panelists. If someone has never smoked, stick to that. Don't smoke in future. If someone is smoking, be a quitter. Eat healthy, stay healthy, do regular exercises that can lead to a health that can last long, and you can stay fit for longer duration.
Thank you, Dr. Rakesh. So, with this, I'd like to bring this panel to a closure. Firstly, I'd like to thank all the panelists, Dr. Suhas, Dr. Amit, Dr. Bhavesh, and Dr. Rakesh. Thank you for taking time out and stepping up with Voice of Healthcare in this panel of discussion, raising awareness about lung cancer and its advocacy. Secondly, I'd like to thank Pfizer for powering this particular panel, for also again stepping up in creating awareness around lung cancer in the month of November. Lastly, most importantly, I'd like to thank all the audience, everyone who has engaged with us and have shown. I hope we were able to educate some audience on the lung cancer, its symptoms, and the different subject areas around this. So with this, we'll bring this panel to a closure. Thank you everyone for joining, and have a good evening.
Thank you
Thank
very
you.
much.
Thank you. Good evening. Thank you.
Thank you. Thank you very much, Dr.